Yet another important topic regarding plaque control. Today I'm planning to take class on mechanical plaque control. So before going deep into the mechanical plaque control, I just want to explain few things regarding plaque and what is plaque and what is its control. Dental plaque is defined as a structured, resilient, yellow grayish substance that adheres tenaciously to the intraoral hard surfaces, including removable and fixed restorations. So this is plaque. Effective control of these accumulation of plaque is known as plaque control. There are two ways of plaque control, basically. One is mechanical plaque control, as we do as our usual brushing techniques, brushes. And the next step is chemical plaque control by using chemicals. I'm not going to explain much on chemical plaque control. I'm just going to explain on the mechanical plaque control. Removal of microbial plaque and the prevention of its accumulation on the teeth and adjacent gingival tissues is called as plaque control. This can be achieved effectively by different mechanical methods. In that, first we must know the masses of plaque first develop in the molar area and also in the premolar area, followed by the proximal surface of the anterior teeth and the facial surface of the molars and premolars. In that, different methods of mechanical plaque control or the aids used in mechanical plaque control are toothbrushes, interdental aids, again in toothbrushes, manual toothbrushes, electrical toothbrushes, sonic and ultrasonic toothbrushes, ionic toothbrushes. So these are the different means of toothbrushing. Interdental aids, again, dental floss, triangular toothpicks, interdental brushes, Roxa brush system, bottle brushes, and unit of TED brushes. And there are also some aids which stimulates the gingiva. They are known as gingival stimulators, rubber tip stimulator, balsa woodheads, and others like gauze strips, pipe cleaners, water irrigation devices. There are some of the aids which used for edentulous or partially edentulous patients, cleansing solutions, denture brushes, etc., etc. So once we start with brushing, we have to go a little bit into the history. 3,500 to usually in BC, that means 3,000 years back, Babylonians and the Egyptians brushed by the end of a twig. This is usually seen in the excavations in Egyptian mummies and tombs. 1600 BC, Chinese developed chewing sticks, which were made from aromatic tree. This is again for freshen the tooth. And 15th century, Chinese are believed to have invented the first natural brush, bristle toothbrush, made from the bristles of pigs. The bristles are made from the pigs' necks in which the bristles attached to a bone or a bamboo handle. This design was adapted and often used softer horse hairs, which may Europeans prefer. The first 3-row bristle brush was designed. Natural bristles were the only source of bristles until nylon was invented. In 1938, the invention of nylon started the development of the truly modern toothbrush. The first electric toothbrush in the US was by Dept. The most widely used oral hygiene aid is this toothbrush only, because every person in the world is using brushes. According to ADA, Council of Dental Therapeutics, toothbrush is designed primarily to promote cleanliness of teeth and oral cavity. Types of toothbrushes. We are talking about manual toothbrushes. Angelberg and Claffey, 1998, European Workshop on Mechanical Plaque Control. It was agreed that the features of an ideal manual toothbrush should include handle size, head size, end-rounded nylon bristles, soft filamentous, and filamentous patterns. Ideal characters, they said, normal toothbrush design includes vary in size, design, bristle hardness, length, and arrangement. Parts are handle. We all know it, very familiar. Handle, shank, head, tuft, and a brushing plane. Ideal specification of toothbrush. They specify the brushing surface to be 1 to 1.25 inches in length, 5 by 16 to 3 by 8 inches in width, 2 to 4 rows of bristles, and 5 to 12 tufts per row. Usually the design is more susceptible. Usually the design is a straight angle. And the bristles at that time was hog bristles, which was natural bristles, more susceptible to frying and breaking, contaminated with microbial deposits, softening and loss of elasticity. So they invented synthetic nylon. Uniform in size, elasticity resistant to fracture, repulsion of water and debris. So all the ideal properties of a nylon bristles being incorporated. And there are multi-tufted and a single tufted toothbrushes. Soft, they made this nylon into soft, medium, and hard by its thickness and diameter. 0.007 inch or 0.2 mm, or medium brush of 0.3 mm, and hard brush of 0.4 mm. Proportional to the square of the diameter and inversely proportional to the square of the bristle length. This was the chemistry formula behind the bristles. There are modifications for toothbrushes which you see in commercially available brushes. Long and contoured handle, double angulation to the handle, concave surfaces, deep groove design, and even conventional flat multi-tufted. Many recommend hard bristles, but as a periodontist, we preferably to go for soft or medium, because hard will cause us gingival recession And bars in 1942 with soft bristles has got a wide acceptance. More flexible, clean slightly below the gingival margin when used with circular brushing technique and reach further into the proximal surfaces. These are the brushes what we are just going. Now, because of the problem of manual dexterity, there are people who can't use brushes because they lack the dexterity manually. Power toothbrushes are being invented. In 1885, Frederick Thornberg, the Swedish watchmaker, designed the first mechanical brush, followed by electric toothbrush in 1939. There are currently the available brushes are oscillatory motion, the rotating motion, speed from low to high, and low frequency acoustic energy to enhance cleaning activity. So many people use that because of the easiness of the procedure. But there are advantages and disadvantages, depends on individual to individual. It is indicated basically in poorly compliant patients, maintenance patients. Many persons need many patients need a lengthy brushing time. So these things being controlled, you can adjust the timing, everything in this electrically operated toothbrush. Sonic and ultrasonic toothbrushes, they produce high frequency vibrations, 1.6 megahertz, which led to the phenomenon of cavitation and acoustic micro streaming. Produce cavitation and acoustic streaming phenomena, which aids in stain removal as well as disruption of the bacterial cell wall. So this is one of the good advantage of these sonic or ultrasonic toothbrushes. Now coming to the ionic toothbrushes, it's a very newer invention. They changes the surface charge of a tooth by a influx of positively charged ions. The plaque with similar charge is thus repelled from the tooth surface and is attracted by the negatively charged bristles of the toothbrush. So in this case, ionic toothbrushes got an advantage. Now we are coming to the objectives of the toothbrush. This will clean the tooth, internal space of food remnants, debris, and stain, because many times we are using your fingers. This can go in between your tooths. So anyway, brushes are very superior to your old type of brushing technique. So it prevents plaque accumulation, stimulate and massage gingival tissues, and even clean the tongue. There are different type of toothbrushing methods. Roll technique, modified Stillman techniques, scrub brush technique, Smith's method, Stillman's and Charter method, Phone's method. So there are a lot of people claim their methods of brushing, and many of them are using that. But preferably, we used to prefer Bass method as a unique brushing technique because it's otherwise known as circular cleaning method. In that, all patients for dental plaque removal adjacent to and directly beneath the gingival margin, this method is indicated. Recommended for routine patients with or periodontal involved. Usually, you have to place the bristles at a 45-degree angulation to the gingiva, moved in a small circular motion, and it is swept through the interdental area. Occlusal surfaces are being cleaned with pressing the bristles firmly against the pit and fissures. Many times, overzealous brushing will cause us trauma to the area. It's a bit time consuming and dexterity requirement is too high. That's one of the disadvantages. The advantages are plaque removal adjacent to and directly beneath the gingival margin is being achieved, even in the cervical areas and sulcular areas. Good gingival stimulation and easy to learn. Again, this Bass technique was modified. So we call it as a modified Bass technique. As a routine oral hygiene measures, intrasulcular cleaning combines of vibratory and circulatory movements. Bass technique become one of the routine brushing techniques. It is almost the same technique as I just mentioned before, but vibratory jerk has been added to that. So this jerk will dislodge the food debris, so you can coolly sweep the debris through the interdental area. That is the advantage of that technique. Other technique is by modified Stillman method, that is indicated plaque removal from the cervical areas below the height of contour of the enamel and from exposed proximal surfaces. This technique has been used. In that cases, bristles are pointed apically with an oblique angle to the long axis of the tooth. It is partly placed on the gingiva and on the tooth surface. Then another method, which is Charter's method. An individual having open dental spaces with the missing papilla and exposed root surfaces, they can use this technique. In Fone's method, usually it's been indicated in young children. Circular motion with covers the teeth and gums of the patient. Roll technique. This method is also known as the rolling stroke method. Children and adults with limited dexterity can use this technique. Then we are coming into maintenance of the toothbrush. Many times, overzealous brushing, people used to brush the teeth with a flared out bristle, which lead to cervical abrasion of the tooth surface. So you have to change the brush frequently when you see that bristles has been flared out. Otherwise, you will end up in a deep cervical abrasions and sensitivity. Now coming into the dendriphizes. Substance used with a toothbrush or the purpose of cleaning the accessible surface of the teeth is the material called as dendriphizes. Usual combinations are, it contains a polishing agent, it contains an abrasive agent, a binding thickening agent. The main bulk is calcium carbonate. Mild abrasives are used. Detergents like soap, sodium lauryl sulfate is used. So this is the material used to, and sorbitol as a humectant, it's been used. And some flavoring agents like peppermint and peppermint oil, clove oil, etc., etc. Some are being medicated with triclosan, sodium monofluorophosphate. So these are the typical content of the dentifrice. There are different type of dentifrices. One is anti-decay toothpaste, then desensitizing toothpastes, anti-plaque toothpastes, and also whitening toothpastes or otherwise of bleaching type toothpaste. Some people use tooth powders because it's also available in a form of powders with little more abrasive added. This is an alternative method for dentifrices. But many times they add silica as a fine powders. It leads to abrasion of the tooth. So we didn't recommend much of the tooth powders. Then coming to the interdental aids. This is an adjoint device which are used to remove plaque from the interproximal tooth surface. So to know more about this, you have to know a knowledge on type of gingival embrasures and alignment of the teeth, fixed prosthesis or appliances, or open percussion areas and contact areas. There are different type of embrasures, type 1, type 2, type 3, type 4, and type 5. So these interdental aids are designed in such a way according to these types of embrasures. First one is dental floss. It's a multifilament, twisted or non-twisted, bonded or unbonded, thin or thick, waxed or non-waxed, nylon material. It effectively removes the adherent plaque and the food debris from the interproximal embrasure. Polishing the tooth surface. It also stimulate or massage the interdental papilla. Sometimes it will remove the subgingival calculus. So altogether, it improves the oral hygiene. The unwaxed dental floss is better than waxed one. Smaller in diameter, and it passes more easily through slight interproximal contacts. But there are a lot of disadvantages also. While using these flosses, sometimes it may injure the gingiva. So either it can be used on wounding around the fingers or a floss holder. And commercially available, a lot of dental floss are there. Johnson & Johnson's are there. Colgate is marketing. So you can use such flosses. Now coming the interdental or interproximal brushes. Cone-shaped or cylindrical brushes made of bristles mounted on a handle which is single tufted brushes or small cylindrical brushes. Or it is a miniature bottle brush as we use for baby bottle cleaning. So it's a miniature form of that. This is used as an alternative to toothpicks because it generally go through the interdental space and clean the area. And the type of bristles has to be selected according to the type of the embrasure. It has been available in a range of width and color coded. Depends on the type of the embrasure what we going to use it. There are powered interdentine toothbrushes also, equally efficient in achieving plaque removal and reducing inflammation. It requires less dexterity, make access to gingival areas easier. Then there are wooden tips. It is used in type 2 gingival embrushes, manufactured from orange wood. Triangular in cross section. Insert in the gingival embrusure with base of the triangle oriented towards the gingiva. Then rubber tips are, which are conical in nature. Either it is incorporated into the one end of the toothbrush or maybe a separate handle for that. Easily adapted to the proximal and lingual surface of all the teeth. Even after periodontal surgery, you can use that. And it can be used in sensitive areas. Then a few words regarding gingival massage. Because of the rich vascularity of gingiva, you can massage the gingiva either with your bare fingers or you can use gingival stimulators to massage the gingiva. Few are the irrigation devices, which is again used for cleaning the interproximal area. One is known as water pick. This is one of a valuable supplement for mechanical plaque removal. Mainly beneficial in removal of the unattached plaque and debris. They are composed of a built-in pump and a reservoir. A pulse stream of water or other irrigants which has been used in this water pick. And many has got a supragingival irrigation pointer and a subgingival irrigation pointer, which deeply penetrates into the pocket. So you can irrigate medicaments and also you can irrigate the area for thorough plaque removal subgingival. Nowadays, this has become a controversy. It is called as tongue scrapers, whether it is needed or not. There are a lot of studies regarding plus and minus of this mechanism of tongue cleaning. Many say there is no need for scraping because you are removing a bit of the area of taste buds. Many say these lodges debris, so it has to be scraped off. You can even use soft ones to scrape off the debris if you need. With these system of mechanical plaque control aids, I think I almost touched every aspect of it. You'll get a thorough cleaning of the interproximal area, occlusal area, the facial aspect of the molars, premolars, anteriors, if you use a proper brushing technique with a controlled force. But this lacks the complete removal of plaque, because many times patients with periodontal problem or patients with systemic problems who needs a chemical support. So plaque control is not completed without a chemical plaque control unless and until this mechanical plaque control with the chemical plaque control has to be combined to achieve a very good result. So today I'm planning to end up my talk on mechanical plaque control, stating that the proper usage of toothbrush with proper dentifrice gives you effective plaque control method in case of mechanical one. with this, one more class for chemical plaque control is needed because it's another adjuvant in removal of the plaque, especially the subgingival plaque.